No question, this bill will do harm. In fact, in my mind, it's quite clear that children will die because of this bill.
Gender-affirming healthcare back in the spotlight at the State House, and a House committee has advanced a bill that would ban gender-affirming healthcare for anyone under the age of 18.
It is now headed to the House floor. Our Conley Greason is talking with people for and against the bill. Conley?
The lawmaker I spoke with suggests this bill is about protecting kids, but local advocates say it will instead put kids through extreme emotional, mental, and physical harm. An aggressive attack on transgender people. That's how ACLU's executive director describes a bill headed to the full House of Representatives.
I myself, as a young person, attempted suicide. I remember my parents visiting me in the hospital and asking me why. And it was because I felt alone, misunderstood, and rejected. And that is what we are doing to kids in South Carolina.
On the other side, Berkeley County Representative Jordan Pace. He says gender dysmorphia is like body dysmorphia and compared it to anorexia.
And all the records we have prior to the last 5 years all say if you don't intervene medically, the overwhelming majority of kids who are in these situations totally grow out of these situations.
The bill suggests banning gender-affirming health care for people younger than 18. That includes hormone therapy, puberty blockers, and surgery. 7 Republican representatives in the Low Country sponsored the bill.
I think you could see on some of those legislators' faces that they were really thinking hard about what it would mean to rip healthcare away from these kids.
They can't get a tattoo. They can't get cigarettes. They can't get alcohol. They can't buy firearms. There's things minors shouldn't be able to do. They can't make those decisions, even with parental consent.
Woodrum says medical professionals have data to show this health care is life-saving, while Pace says it's a cash cow scheme.
I find it a little disconcerting that the medical professionals who make a living from these forever patients are the ones telling us we're doing them harm by not letting them harm themselves.
Politicians in South Carolina have decided that they know better than doctors what the standard of care should be. That is far beyond the scope of what we ask them to do when we elect them.
The bill now goes to the full House of Representatives next week. It's scheduled to be discussed on Tuesday. Working for you, Conley Greason, News 4.